My name's Lauren and I work as an early years IDVA at Safe Steps, Southend's commissioned domestic abuse service providing support to individuals and families. The early years IDVA provides support to parents experiencing and disclosing domestic abuse through conducting risk assessments, making referrals, providing immediate support and risk reducing actions. As part of Safe Steps, we also have fledglings, Break the Cycle for 13 to 19-year-olds and Essex Compass. This includes IDVA services, a young person's IDVA service, child and family recovery support and Essex Compass. Essex Compass is your specialist domestic abuse helpline and is accessible 7 days a week, 365 days a year. Within Safe Steps IDVA service is a dedicated early years IDVA support team in partnership with the Better Start Southend and affiliated with YourFamily and Southend Family Centres. The partnership aims to reach all professionals coming into contact with parents or children aged under 5 to spot the signs of domestic abuse, understanding the impact it has on children and how to get help. This image shows how the referral process works between Safe Steps, YourFamily and Southend Family Centres. The victim or survivor with children under 5 can access specialist domestic abuse support by self-referring into Essex Compass or Safe Steps. Any standard or medium risk referrals will come straight to the early years IDVA service. Be mindful that they will not always self-identify as a victim of DA. As both YourFamily and Southend Family Centres work with families with children under 5, once a self-referral or a professional referral is made to either YourFamily or Southend Family Centres and there is an identified domestic abuse need, then the family or individual can be referred into Safe Steps via Essex Compass. All professional referrals must be made via Essex Compass. The early years IDVA can refer to both Southend Family Centres and YourFamily once the support needs are identified. If in doubt, please use Essex Compass as your first point of contact.
Hello, my name is Paul and I work with the YourFamily team. YourFamily is the friendly local community for expectant parents and families with children under 4. We have a team of experienced practitioners who are available to speak with families about all aspects of parenting and can meet families either in the community or at one of our drop-in sessions, or we're happy to chat on the phone. We support victims and survivors of domestic abuse by listening to the family's story and then sharing with them details of what support is available in Southend. We work closely with our colleagues from Safe Steps and Family Centres who provide specialist advice and information, and we will then link families to the relevant support that works best for them.
My name's Fiona and I work for the Southend Family Centres. Southend Family Centres provide emotional and practical support to survivors of domestic abuse. Working closely with Safe Steps and our IDVA practitioners ensures the right advice and guidance is provided as safely as possible. The Family Centres deliver the Freedom Programme, which is a domestic violence and abuse course that supports survivors to think about the effects of abusive relationships on children, helps to restore confidence and recognise patterns of abuse in relationships so they can feel more confident to develop caring, respectful relationships in the future.
Defining abuse. Domestic abuse is defined as an incident or pattern of incidents of controlling, coercive, threatening, degrading and violent behaviour, which can include sexual violence. This isn't just limited to physical violence. It can be emotional abuse, including coercive control, and financial abuse, including controlling money. Domestic abuse is complex. It can affect anyone regardless of age, social background, gender, religion, sexual orientation or ethnicity. Domestic abuse does not only occur between couples in intimate relationships, it can also involve family members. In April 2021, the Domestic Abuse Bill was passed by the government to support all victims of domestic abuse. The Act aims to ensure that all victims have the confidence to come forward and report their experiences. Councils were required to carry out a needs assessment and formulate and publish a domestic abuse strategy to provide safe accommodation to domestic abuse victims. Domestic abuse is a national issue. According to the Domestic Abuse Act 21 Needs Assessment for Essex, Southend consistently has the highest volume of incidents reported to Essex Police. This has been the case for 8 consecutive years. Essex Police responded to 1,013 domestic abuse flagged incidences where a child of 0 to 5 years of age was present. It must be noted that DA incidences are significantly underreported to the police, therefore this number is likely to be far higher. Essex Police report there has been a 5% increase in all DA offences in Southend from 2021 to 2022, with high-risk incidences increasing by 8.1%. Types of abuse. When we're talking about domestic abuse, we're often talking about the following actions or behaviour: pushing, slapping, strangulation, stabbing, neglect, headbutting, choking, and murder. You can now pause to read the full list. Spot the signs. There are some common behaviours to be aware of when looking to spot the signs of domestic abuse. You can now pause to read the full list. It is reported that there is a higher chance of abuse starting or escalating during pregnancy. Pregnant women are most at risk when preparing to leave their abuser, so it is important to think of this when safety planning. It is estimated that 4 to 9 in every 100 pregnant women are abused during their pregnancy or soon after birth. Impact on children. Domestic abuse will have a huge impact on a child, although many parents believe that their children have not been exposed, but the sum of all of our years' experience tell us they always are. The World Health Organization recognises that the impact of domestic abuse goes beyond the health and well-being of individuals to include children, families, and whole communities. Children are often the silent victims of domestic abuse. In 90% of domestic abuse incidents, children are in the same or the adjacent room when the abuse occurs. Children are not passive witnesses to domestic abuse. The exposure itself is also abuse. The impact on children can be brain development and overactive stress response. The trauma of domestic abuse undermines a child's basic need for safety, which can impact brain development. The brain overdevelops the survival part, leaving less capacity to later develop cognition. It's like an oversensitive alarm system. Examples of this can be seen in challenging behaviour, refusal to go to school, poor anger management, and emotional regulation issues. Psychological and mental health. Psychological and mental health issues can be identified by a child becoming withdrawn. They exhibit people-pleasing behaviour, low self-esteem, self-harm, including substance misuse, anxiety, and depression. They may also have difficulty concentrating, which can often overlap with symptoms of ADHD. Education. Domestic abuse can impact a child's education through decreased attainment and attendance at school. Alternatively, it could be their safe space, or they are too scared to perform badly. In 2020, there were 2,933 reported domestic abuse incidents where a child was in the household. The Domestic Abuse Act legislative measures also now include a new statutory definition of domestic abuse and identifies children as victims rather than witnesses. That's why now more than ever, it is important to understand the devastating impact of domestic abuse on children. Professional standard guidance. The National Institute for Health and Care Excellence Quality Standards recommends that people presenting to frontline staff with indicators of possible domestic abuse are asked about their experiences in a private discussion, given time and with an official interpreter if the individual does not speak English. After any disclosure, safety is paramount. This can be challenging when a survivor is accompanied to a health appointment or an early years setting by their alleged perpetrator or a family member, so it would be good to discuss or role play in your next team meetings how you could achieve this without arousing suspicion. We do this in our role as IDVAs. We practice different scenarios so that we're prepared. If you are a clinical professional, you will know the examinations or health questions you ask. Think about how you could use these to have a private discussion, or if you're an early years practitioner, you will know the family and parents well, so consider how you could approach this. Another of the quality standards is that people experiencing domestic abuse are offered referrals to specialist support services, so it is important to know who your local services are. Safe Steps are your Southend Commission provider, and you can refer into Compass, who operate Pan Essex, if you are unsure what provider covers your area. A survivor of domestic abuse may reject your offer of support. They may even want the alleged perpetrator to see them reject your offer. This is about survival, and this is why it is important to have these conversations in private. Clearly displayed information in waiting areas, patient toilets, and other suitable places about the support on offer is also recommended. We've mentioned indicators of possible domestic abuse. Here is a list of some health-related indicators as listed by the Royal College of Nursing. You can now pause to read the full list. Domestic abuse is a major safeguarding issue, and anyone coming into contact with parents, from healthcare professionals to early years practitioners, have a role to play in increasing awareness and should begin inquiring when confronted with behaviours that raise concerns. How to respond. Once you have successfully separated your potential survivor from their alleged perpetrator, or if you have received a disclosure, how can you respond? Firstly, you should believe them. A listening ear, asking open questions and keeping a record of what has been disclosed is the best way to begin. It may be helpful to have some key questions ready to start a conversation when concerns are triggered. Some examples may be: questions that can more specifically relate to children can include: confidentiality is paramount, as is honesty, so be transparent as you may need to share safeguarding concerns if they are at high risk of harm or if you have a child or vulnerable adult who is at risk. You can assure them that they have done the right thing in telling you, and it is important to explain that they are not alone and not to blame. Do you know who to obtain help from? Your manager or local safeguarding lead would normally be your first points of contact. If you believe somebody to be at immediate risk of danger, contact the police and the local safeguarding lead. The next step would be to refer into Essex Compass. Unlike high risk or safeguarding referrals, we do require survivor consent. The team consists of domestic abuse, sexual abuse and stalking trained staff who offer informed, non-judgmental support and will complete a client-centred safety and support plan before forwarding their case for ongoing info support. This would be Safe Steps for those living in the Southend area. Safe Steps provide independent advocacy and crisis support covering all aspects of housing and homelessness, support with civil and legal criminal matters, family law matters, financial concerns, immigration and social care matters. We can support with access to parenting support and help build resilient networks with our partners at Better Start Southend, YourFamily and Southend Family Centres. This valuable partnership has brought you this video and is continuing to work together to bring knowledge and confidence to communities and professionals in Southend to recognise the sign of possible abuse and have the confidence to inquire and the knowledge to safely and appropriately respond. It is vital to reassure survivors that support is available. Here's how to contact us should you need to, but remember, if you're in immediate danger, please call the police on 999.